Hi everyone, my name is Madison Davis, and today I'm going to be talking about the leading health indicator of reducing the rate of infant deaths. What is a leading health indicator? So, leading health indicators are a small subset of high priority healthy people 2030 objectives that are selected to drive action towards improving health and well being. So, leading health indicators are used to address certain factors that cause major illnesses and death in people all over the United States. What is Healthy People 2030, you may ask? Well, there are a few ways that Healthy People 2030 organizes its objectives into three categories. Those categories are core objectives, developmental objectives, and research objectives. Core objectives are used to track progress on if a goal is being achieved. Developmental objectives are the public health issues that are backed by evidence-based interventions that do have the potential to become core objectives if reliable data is found. And then research objectives are the public health issues with disparities between population groups. How do you use Healthy People 2030 in your daily work? On this slide, there are 4 different ways that are listed on the Healthy People 2030 website on how it can be used in everyday life. Hoyer et al. Highlights that a strength of Healthy People 2030 is its use as a framework to reveal disparities and challenges like the disparity in well-being among people with disabilities, and pinpoint research and interventions needed to address those challenges. Nurses are able to use this framework in their daily work by applying it to their field of work and using evidence-based resources. So while yes, the point of Healthy People 2030 is to acknowledge disparities in health outcomes with the overall hope of improving them, but the question is, how do they keep track of this? So the goal icon system is the way that Healthy People 2030 keeps track of how leading health indicators are progressing. And this is whether or not they get closer to the goal. There are 5 icons which include baseline, target met or exceeded, improving, little or no detectable change, or if it's getting worse. On this slide, we're going to discuss the what, why, and the goals of me choosing reduce the rate of infant deaths. So in the U.S., thousands of infants unfortunately die due to preterm birth, low birth weight, and SIDS, and there are some health disparities by race, income, and geographic location that play into this. Ellie and Driscoll highlight that infant mortality as an issue in the United States and that the rate is definitely decreasing with time. The goal is to hopefully provide high-quality care for moms and babies and to implement community-based interventions. It's important to adhere to communities to hopefully decrease the rate of deaths. Personally, I chose this because I'm a mother-baby nurse, and I feel very strong about prenatal education, postpartum education, and promoting safe sleep to hopefully one day save the life of a baby. Not only does Healthy People 2030 identify the disparities that are taking place in the United States, they also have health promotion interventions listed. So by making sure that minorities receive the same level of care and education as everyone, the incidence of infant deaths can eventually decrease. By promoting safe sleep, you can drastically decrease the prevalence of sudden infant death syndrome, or known as SIDS. Safe sleep includes a baby flat on their back, no extra blankets, alone in a bassinet. And maternal education during pregnancy and postpartum will promote safe sleep behaviors after the pregnancy. When this became a leading health indicator, there were 5.8 infant deaths per 1,000 live births that occurred within the first year of life in 2017, which is a lot of people. However, the status is improving. The mortality rate since 2024 has slightly decreased to 5.5 infant deaths. If there is more access to prenatal and maternal health care services, healthcare providers can also improve health outcomes by preventing and managing complications during pregnancy and postpartum. A significant body of research, including multiple systemic reviews and meta-analysis, has affirmed prenatal care's effectiveness in enhancing maternal and neonatal health. While there are strengths that measure meeting the goal, there are also different barriers and challenges. Though infant mortality is decreasing, there are a few challenges that I'd like to talk about that do increase the risk of infant mortality. Research shows that to improve the prevalence of infant deaths, high-quality maternity care is necessary. Lucas et al. Highlights that adequate prenatal care decreases the risk of infant mortality by providing protective interventions such as the treatment of chronic conditions, education on preterm birth signs, maternal vaccination, and early detection of fetal complications. In addition to inadequate prenatal and maternal care, unsafe sleep environments remain a cause in the prevalence of infant mortality, specifically sudden infant death syndrome, which is known as SIDS. The AAP provides recommendations for safe sleep in hopes of decreasing sleep-related deaths. Despite these recommendations and parents being educated, the control of the safe sleep environment ultimately falls in the hands of the caregiver. So nurses do hold some responsibility in promoting this goal. Nurses can aid in reducing the rate of infant deaths by focusing on education during the prenatal and postpartum period on safe sleep for infants to prevent SIDS. According to the CDC, this education can include benefits of good nutrition, avoiding drugs or alcohol, and safety for newborn and infant care. By providing early care to the mom through pregnancy, serious complications and health conditions can be treated and found early. These are the resources that I used to gather the information that I presented in this PowerPoint. Reducing infant mortality is an incredibly important goal to focus on for public health. I hope that my presentation highlighted the significant number of children who die before they even reach their first birthday, with a lot of those deaths being preventable. Most importantly, I hope you take away that it is vital for nurses to provide excellent prenatal, postpartum, and continuing education, use evidence-based practice, advocate, and intervene early if something is going wrong. Thank you all for taking the time to listen to me talk about something that I'm super passionate about, and I hope you all have a great day.